Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Vendor Education Series, and I'd like to welcome you to our latest session presented by Benelink. Our presenters today are Vicki Jessup, Vice President of Government Relations with Benelink, and Kesley Crichton, Chief Sales Officer with Benelink, and they are presenting Ensuring Continuous Eligibility via SDoH Outreach. But before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be recording today's call, and we'll post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our home page and click on the preferred vendors link. And you can also post a note, an RFI, or even an RFP on the preferred vendor connection portal. And of course, during today's session, you can ask a question at any time by clicking the Q&A icon in your Zoom window and typing in your question. And all of the questions will be answered at the end of the presentation. Now, I'll pass it over to Vicki and Kesley.
Thanks, Ron. Hope everybody can hear me okay. We're going to jump in and get started here. I think I've probably spoken to most of you on prior webinars, but my name's Kesley Crichton, and as Ron said, I'm the Chief Sales Officer for Benelink. I'm joined today by my colleague, Vicki Jessup, and Vicki brings years and years of experience with her from both government, as well as we've worked together for what seems like a couple decades now, going back to our days at SSC, Altagra Health, Change Healthcare, which is now part of Optum. And we came together about 4 or 5 years ago again at Benelink. So she's really the subject matter expert on Medicaid eligibility and renewals that all of us rely on for so many of our business aspects within Benelink. And so she's going to chime in a little bit and talk a little bit about Medicaid renewals, what's going on in many of the states, and best practices. So if you guys could do me a favor and use the Q&A to just type in there and tell us where your plan is located, we will try, she will try her best to give you relevant information for where some of you are from. So jumping in and reviewing the rest of the agenda, we're going to talk about social care programs. We're going to talk about why it's important to kind of tie those to a Medicaid renewal, and then our approach, but more importantly, just some tips that you can all employ, whether you're using us or yourselves or any other vendor. So to level set, everybody's probably seen, us talking about the unwinding process and the continuous coverage requirement for, 3 years now, right? We never expected it to go on this long. But what we want to talk about today is that CMS granted some states a level of flexibility about the unwinding process, right? Such as when the process will begin, how rapidly it will occur, what's going to be allowed and who's going to be in this COVID unwinding process. And all of that really just adds more uncertainty to the impact that many states are going to have when it comes to which members are not going to get through their renewal, right? What's your impact on 2023 membership going to be, as well as 2024, as this continues to unwind? And so as an example, only 5 states that I'm aware of so far have begun their redetermination process. So while most said they were going to start in April, really only 5 have, and they've taken the most aggressive approach. And what we really want to talk about today is there's still time, right? There's still time to impact even those 5 states, let alone everybody else that hasn't really started doing much yet. And so what can you do to really impact and make sure members on both the Medicaid side, if you're a managed Medicaid plan, or if you're talking about duals, don't lose the valuable benefits that they have. And we're going to jump back and forth between managed Medicaid and Medicare Advantage a little bit. We'll try to clarify wherever we're talking about one or the other, or if it's applicable to both. So a couple examples. Arkansas definitely appears to be the most aggressive. They already started terminating members, and according to the Arkansas Department of Health website, 72,000 individuals have already been have already lost coverage as of April. That's a 7% reduction. And so Kaiser Family is estimating that 9% of all members will lose Medicaid due to some type of administrative failure, like not responding to a letter, not receiving the letter, not sending back additional requests for documentation. 85% of the 7% in Arkansas is due to a procedural failure. So it's really, really important to get out in front of these members, make sure they're updating their contact information, make sure they're looking for these forms. And Vicki will talk a little bit more about some of the best practices that she's seen by different states. Idaho is also right up there with Arkansas. Both of them are hoping to complete this entire COVID unwinding process within the first 6 months. So from April through a short period of time. And Idaho started by, they have a lot less members that a lot of our states have, right? They have 450,000 Medicaid members. They think that 300,000 are still qualifying and can be renewed with maybe ex parte or some type of passive renewal, but 150,000 that haven't had any communication with their Department of Health since COVID began and haven't responded to any of the mailings, they think are going to lose Medicaid in that state. And they're sending out about 30,000 notices a month trying to engage this population of 150,000. So again, a much higher population than the 9% that Kaiser in those two states is estimating. So we're going to talk about just why we think it's important to kind of integrate a social care program, right? And this really depends now, the reason why behind it on what population. Managed Medicaid is very different on using a social care program to attach to a Medicaid renewal than a Medicare Advantage, right? For managed Medicaid, when we've done focus groups with these members, the biggest issue that we have seen is that there's just a lack of brand awareness sometimes, or brand loyalty, right? They know they have Medicaid, but they might not even remember which one they have. And so now you're asking these members to do something, and if they're haven't used their benefits recently, they might not have enough incentive. So engaging a social care program, finding member-centric reasons to reach out and help that member outside of their health care, but still tied to it, right? Social care needs around their health, we think is a great way to open up a conversation and engage more members. Medicare Advantage, you're going to check a whole bunch of boxes by integrating a social care program, right? You have your new SNSE measures, you have SNAP requirements, you have lots of reasons to put these two together. But again, it's about finding reasons to engage those members, getting them to participate more, and just talking about sometimes a Medicaid renewal that they might or might not be expecting doesn't work as well as talking about a program that could save them money or provide them with some extra benefits. So that's why we like integrating these two programs together. It doesn't have to just be these two, though. You can think about other opportunities that you have on managed Medicaid. Are you already doing some type of SSI identification? Are you trying to promote annual wellness exams on either population? What other messaging can you combine so that you're making your outreach efficient for not only yourself, but for your members as well? So social care is what really allows us to kind of move this forward. And some of the goals that we think, and you all have your own goals, I'm sure, that we think that you want to accomplish, and many of our clients have relayed this to us, is they're trying to do a couple different things when they put these programs together. One, they want to identify and assist as many members as possible with social needs, right? And it doesn't really matter what cohort. Everybody's got some type of, in Medicare or managed Medicaid, some type of need that we think that we can address. We want to identify and assist veterans, and more specifically those using VA. This is really important for Medicare Advantage, where all that care is hidden from you. Those charts at the VA are just loaded with good information that impacts care management and risk adjustment and quality gaps and so forth. But just, it goes a long way to knowing who your veterans are and just thanking them for their service. So that's a big thing that all lines of business can do, is just identify their veterans. And putting that all together, where our goal, our ultimate goal, right, is to improve member retention, get as many members to complete their renewal as possible. If they're no longer eligible on the managed Medicaid side, to have a pathway to get them transitioned over to your ACA plan or your state's office that will help them find an ACA plan, because many of them will still qualify for some level of subsidy. And then when you do all of this, right, you're going to generate good brand awareness and brand loyalty. We encourage you, whether it be us or yourselves or another vendor, that you really promote your brand and your logo throughout all of this outreach. And there's a lot of challenges associated with it. There's a lot more challenges than I have goals here, right? So funding is always the biggest one. I know for managed Medicaid plans, a lot of states have done 1115 waivers and put some funding in there to create these type of programs. But either way, you're still going to have to show some type of ROI, right? And so when you're building this out, how are you going to measure that ROI? How are you going to document the barriers? How are you going to surface meaningful solutions and document those too? And how is all that going to come together so that you can measure the impact that you're making? You want to measure the increase in retention, the increase in the lowering of the disenrollment due to administrative reasons, right? You want to work on how are you going to identify, prioritize, and reach these members. Again, that has become more and more challenging over the past, 3 to 5 years as that spam likely that shows up on our cell phones for just about even when your mom calls, right? So working on identifying those and having a multi-channel approach to that. And then putting that all together so that ultimately the member retention issues are not new for managed Medicaid or for duals, right? But how do we really address those today? Because the retention issues are different. It's about a population of people that maybe have never done a renewal or that haven't done a renewal for a long time. So drawing people's awareness back to having to do this and complete that is really what's the most important aspect of this. Okay, I am not seeing the Q&A, so I'm just going to pause to see if anybody has any questions yet before we just do a little bit of a commercial here on just what we do and give you some tips that you can employ at your own organization.
We have some people from Nevada, Washington, Idaho, Utah, and Oregon.
Okay, great. All places that I want to go visit. So give me a call when this is over, especially in the summer. So, all right. Vicki can take that when she's talking about those states. So what we do here at Benelink for our clients is really about addressing, we have a tagline, we lead with help. And we lead with help, and we've been doing this for 20 years through our history of all of our organizations, way before anybody ever heard the term social determinants of health. And we did it for one reason, because it allowed us to engage more members for other reasons downstream. But so addressing those, identifying those barriers that people have in their life and surfacing a solution all in one call, we think is really, really the key to any type of program where you're asking your members to engage and do something that you want them to do. So identify new program opportunities. If you're screening somebody for Medicaid, make sure that you're screening at the highest level if you're a Medicare Advantage plan, right? A lot of vendors only will do Medicare savings programs, which usually only gets you partial Medicaid, and not know every nuance. So this is where Vicki's key. She makes sure that we know all the pathways to both partial Medicaid as well as full, that we're always up on the latest eligibility criteria that's applicable there, and any nuance that some states might have. But also if you're a managed Medicaid plan, right, know that when some of your members got enrolled in Medicaid maybe years before, they didn't also, that application might not have been tied to cash assistance or SNAP. And so the state renewal sites now can allow them to apply or renew all of those benefits. Most of the state's websites that I've seen will allow them to put all that together in one easy application or one easy renewal. So look for helping members keep all their benefits. And again, that key to efficiency is really important. And then again, I've already talked about the veterans, but identifying those veterans. Little known fact, on a Medicare Advantage plan, on average, 22% of your members are veterans. Mostly over the age of 65, just because that times into the conflicts that we were part of in the US. And about 5% of those members are using the VA facilities in addition to your network for some or all of their care, right? So some of them are going to look like healthy non-users, and they're not going to be showing up on your chase list for things. And the VA doesn't have a lot of tech when it comes to EMRs and so forth, but they're really good documenters, and they do a really good annual wellness exam, which is required for the VA, for the veteran to use the VA facilities every year. So this is what we put together. You can also think about, as I said, other things. Do you want to screen members for SSI if you're a managed Medicaid plan? Do you want to include flu shots, reminders, or whatever other, reasons that you're kind of reaching out to engage your members? And we think that documentation is key to meeting the requirements that states and CMS are putting forward, as well as NCQA, right? So when we are talking to a member and I'm trying to understand their challenges, we're going to use ICD-10Z codes to document those challenges. And when we surface the solutions, again, that solution is going to be documented using LOINC and SNOMED codes. And we want to use a standardized assessment. Doesn't matter if it's 3 questions or 20 questions, right? Needs to be standardized, and the answer and the response codes needs to be standardized too. So that will help you share that information, ingest it in your TriZetto system or your Epic system or wherever it needs to go, so that multiple business units and the providers can follow up and reinforce that social care that you're trying to promote within your members that have these needs, right? And then while you're engaging those members and you're helping them with whatever database programs you want to use, 211 or Find Help or Unite Us, whichever one, right? At the end of that, part of that, you've just done something meaningful for that member. It could be you help them find, lower costing diabetic drugs or supplies or whatever it might be, but you've done something for them. So now is the time to say, we need you to do your Medicaid renewal as well. And tying those 2 things together, we've seen uptakes on renewals for years and years at our organization. So diving into how this fits into Medicaid retention, I'm going to turn this over to Vicki, and she's going to talk about just the level of specificity depending on what state you're in and how, if you're in multiple states, how you can build a program that addresses all the different avenues that a member can use. So say hi, Vicki.
Hi, everybody. Good afternoon. So over the past couple of years, states have really implemented a lot of very innovative strategies to promote retention. Everyone knew this unwinding was coming. It took longer than everyone anticipated, but here we are. Some of the things that they've done, I've organized in sort of 3 main areas. One is partnering and transparency, eligibility policy and procedure changes, and then really thoughtful consideration about the impact on members and their experience through the renewal process. To sort of start with partnering and transparency, states are partnering with MCOs and other stakeholders at really unprecedented levels, I think. They're sharing files with information about members who've got renewals coming up. They're sharing data about members who have recently closed, providing the reasons why the closure occurred. So if it is procedural and there's still time during that reconsideration period, the renewal can be done late. If the member is no longer eligible because of income or something, the plan can educate them about marketplace options. They're also allowing post-disenrollment outreach, which is new, and accepting information about contacts, addresses and phones from MCOs, that's new. States are making renewal date information available in provider portals where eligibility checks occur. So if a provider is doing an eligibility check and they can see the renewals coming up when the patient comes in for that appointment, they can give them a little reminder to make sure the state has their updated contact information and to be paying attention to the mail. A lot of transparency around closure data. Kesley mentioned Arkansas has a website publishing their closure data to date for the first month. Utah, I know we've got someone on the line from Utah. They're really good about making data available to the public, as well as Pennsylvania has even a filter, or filters, I should say, to segregate the data by age group or county or even down to zip code level. In terms of policy and procedure changes, states are making a lot of gains in improving the ex parte rates. Ex parte is a passive renewal where the member doesn't really have to take any action because the state's able to verify the information through data exchanges. The ex parte rates tend to be significantly higher for the MAGI population than the non-MAGI or ABD population, but states are moving to improve those rates. Kaiser Family Foundation published pretty recently that the average of non-MAGI ex parte renewals is about 25%, but states are improving system rules and adding additional data sources to increase that rate. I know we've got someone here from Arizona, and they're one of those states that I'm sure has ex parte rates much higher than 25% for the non-Magi, and really using robust data matching to renew as many people passively as possible. States are also making policy changes to align non-Magi and Magi renewal policies. So for example, Massachusetts just very recently changed the late renewal reconsideration period from 30 days to 90 days for the non-Magi population. States are adjusting their reasonable compatibility policies. Example there is Wisconsin is using a 20% reasonable compatibility threshold throughout the unwinding period to try to minimize disruption. And then I know we have someone here from Oregon, and this is pretty cool. They created a bridge plan to provide coverage for members who have income between 138% and 200% of poverty to prevent coverage loss during the unwinding period. And then in terms of thoughtful consideration about the member experience during the renewal process and the impact on members, several states are considering insurance utilization and health status when they created their renewal distribution plan. So putting high utilizers and people with a lot of health challenges towards the end of the line to maintain that continuous coverage for them as long as possible. States are using new communication modalities, email and text. That's pretty new for states. And they've added a lot of new renewal options that weren't previously available. So in states that didn't previously have capacity to do a telephonic signature, they now have got that technology, and members can complete the renewal completely over the phone and sign it. A lot more states have online renewal functionality. Previously a lot of states, you could apply online, but weren't able to use those online tools for renewal. Also seeing a lot of document upload options. So people can scan in their paperwork or take a picture or something and upload it electronically. States have made a lot of sample renewal forms available, created how-to videos, step-by-step instructions. Some states now have like live chat features where you can request a chat and get a live person, not just a chat bot, to answer your questions, and as well as online contact forms, where you can, fill out an online, quick little form and someone will get back to you. I've tested these out and they work great. And the chat, it depends on the time of day, but it's usually between 5 and 20 minutes. And when I've used those online contact forms, I get a response the next day. So pretty cool. And then states, many states are also using colored paper and envelopes to improve the messaging impact. So for example, in New Mexico, the renewal envelopes are turquoise color. New Hampshire's using pink. Texas is using yellow envelopes that say action required in red font. Minnesota has a blue circle on the envelope that says important information enclosed. And the theme there is when it's blue, it's time to renew. So all pretty cool stuff. And what you're looking at here is our renewal education. A little snip of that, but I'm responsible for the data that's behind all of these tabs. And I can tell you I packed in as much detail as I possibly could for each of these options. And we've got the data organized according to Medicaid type, well, at least 3 main types. We've got a renewal information available for ABD Medicaid members, as well as Magi members, and then MSP members. And in many states, it's all the same regardless, but there are differences based on the type of Medicaid that members have in terms of some of the options. Like for example, in Connecticut, Magi members use a different online site than ABD and MSP members do. In New Jersey, it's a completely different agency. For MSP, the eligibility is handled by the State Division on Aging, whereas Medicaid for ABD and Magi is handled by the county welfare agencies. So for each of these details, when you when we're speaking with members who have an upcoming renewal, we know what kind of Medicaid they have. If they're dual, we've got the dual status code and we can distinguish between ABD and Medicaid that way. If we're doing this for a managed Medicaid plan, we know we get the MAGI ABD indicator from the plan. So the system automatically knows which information to display here. And then if, an agent, explores all the options that are available for this particular state and this particular type of Medicaid, they can say which one would work best, and they click on that little tab and it'll give them all the deets. If they click on mail, it'll say, did you get the turquoise envelope, or did you get the envelope with the, the yellow envelope with the red stripe, whatever. It gives them the, if the state should have sent a prepaid envelope, it'll say use the prepaid envelope, but if you don't have that, here's the address that you should use. We also have blank renewal forms when they're available. So if the member says, you know what, I didn't get it, or I lost it, or my dog ate it, we can print, or email a duplicate copy of a blank one. If they click on fax, we'll give them a statewide fax if that's available, or a link to for our staff to be able to find their local office. Some states have options to email the forms back. As I mentioned, if phone renewal is available, it'll have the phone number they should call, TTY numbers, hours of operation. For the online option, which we've got the example here, the Colorado Peak, which is in different color there, it's really a live link. So our staff can, click on that in another window and see exactly what the member would see. And then we provide details about where they should click, how to create an account, how to reset their credentials. We've got links to state documents, with additional instructions or how-to videos, all of which can be shared, with the member. If in person is what they want to do, it'll provide instructions about how to call and schedule an appointment. And again, a link to the state's, local agency directory, so that, we can plug in the member's zip code or city or whatever the case, and be able to give them all the details about their local office. We also use very state-specific terminology. So if the state calls it a renewal, we call it a renewal. If they call it a review or a recertification or a redetermination, we want to use, the same language that the state's going to use. We also want to call the program what the state calls it. So if the state calls it Husky C, like they do in Connecticut, that's what we're going to call it, not Medicaid, because the member may not know what we're talking about. They're like, I don't have Medicaid, I have Husky C. And then in addition to the live education that we just talked about on the previous slide, we also have very state-specific instructions on our letters. So gives them all the options that are available and then how to take advantage of that particular option. What did I miss, Kesley? Did I leave anything out?
I don't think so. That was pretty
Okay.
good. But,
right.
Vicki has to do this for all 50 states, right? So just everything that she named, if you're only in 1 or 2 states, we just think it's important for you to give this information to your customer service people or whoever it might be receiving those calls from members that might be confused, or if they're calling in for someplace else, for some other reason, and you have the ability to load those Medicaid renewals somewhere, that again, you're able to remind and assist people with the right information for upcoming renewals, because it's just going to be, in some of these states, it's going to be a mad dash and others are slow playing it, but it's important to reiterate it over and over again. So any other questions, Ron, coming up in the chat?
Not at this time.
Well, that's pretty much all we had for you today. So we try to be short and brief and give you little snippets of information on what we've learned. As a community partner in many states, we're actually doing and completing renewals for some of our clients' members, and that process has gone really, really well. Arizona has been great to work on with. One of the key things that I'm not sure if you mentioned, Vicki, but I just want to reiterate, is the states are really prioritizing, if somebody doesn't qualify any longer, that you have built into your scripts a pathway and a warm transfer to whatever the state organization is or your ACA plan or both, right? So if you go through the renewal, most states are encouraging every member to at least try to complete the renewal, but if they don't get approved, to have those numbers available. So in Pennsylvania, it's Penny or that does all of the different ACA plans for the state, and having that information and trying to warm transfer them. So to make sure that they follow up on and that we don't have any coverage gaps, even for the members that no longer qualify. So again, bringing it kind of back to the SDoH program, again, we believe that is just really, if nothing else, it's important to understand what other challenges your members are facing that might be impacting their healthcare needs, right? Are there some of the big ones, right, across the domains of transportation and food insecurity and financial insecurity that could be impacting whether or not they're receiving care for their chronic illnesses or just their preventive care, and documenting those and surfacing solutions. I don't think there's anything worse than asking somebody about, if you're doing a home assessment, right, and you notice that there's no food in the fridge, asking them about their food insecurity and then not helping them with that. So we really think the timeliness of doing an assessment and surfacing solutions needs to be as short as possible. It's important, mostly for Medicare Advantage, but depending on what your state's P4P is too, that you have this insight, because whether it's going to end up in your quality metrics or in risk adjustment, knowing these different elements of your members that are going to be part of the health equity index and the challenges that are associated with that and how it's going to impact their care is going to help you maintain that revenue accurately for both risk adjustment and quality performance or your state P4P. And we know intuitively, I think we all know, at least on this call, right, that if we address these challenges and we really get members to participate in overcoming the barriers that they might be facing, that we can make a positive impact on their overall health and their quality of life. And ultimately, if we get them through the renewal at the same time, also, we make a healthier, stickier member all in one process. So that's all we have. We're all happy to take some questions from anybody. I'm in sales, so give me a call.
We do have a couple. Can you tell us what database you use for community programs?
We do. Yeah, we use Find Help right now as our partner, and we've really enjoyed our partnership with them for a couple different reasons. One, we have this Veteran Link program, and they went and curated programs for us specifically to veterans when we first started. And we thought that was important because a lot of veterans don't like programs that they might think are more of a handout. But if the eligibility criteria is that you have to be a veteran to receive it, they went and found about 7,000 or 8,000 programs and added to the database specifically for veterans. They've also been really good partners to us to help us close the loop, right? Something that a lot of people talk about and states are always looking to do. And it's challenging. Some of these community partners and CBOs are just not set up to be overly tech savvy, right? They don't want to use somebody's software. They're not really documenting who the member is. They're just trying to do good for the population in their community that they're serving. So we just hired a new person to work with Find Help to build better CBO relationships and to help close the loop on some of that outreach. We also survey members. We get the Net Promoter Score that we ask them if they're willing to refer their friends or relatives to that and how they would rate their plan. And we use that as well as online surveys and automated surveys to ask them if they received the benefits for which we assisted them with. So that was a long answer. To Find Help is the answer to the question. Anything else, Ron?
Yeah, how do you reach out to members?
Every way we can. Seriously, it gets more and more challenging every day. We always try to start with a letter so that we're not cold calling. And our preference is to reach out as the health plan or on behalf of the health plan, but to use our health plan or a provider. We work with some provider and health systems as well to put their logo on the outside of the envelope. So that's the first way, but then texting, especially in the managed Medicaid population, we love doing a text next. We have live advocates. We have almost 400 advocates in 29 states around the country and in Puerto Rico, if we got any Puerto Rican plans on the phone with us today. And then ultimately we can also email information out, but we don't typically use email as the first approach. We like to start with mail, go to text, and then live advocates. And the first two, we're really trying to encourage a callback, right? We ultimately want to speak to the person, not just operate over the phone or over a text message. So the call to action is usually, please call us. We're available 8 to 8, Monday through Saturday. We're here to help you. So even the first two, while we're sending information that's useful to them, we're always available to chat with anybody that wants to call in.
Okay, well, it looks like that takes care of our questions for today.
All right.
I'd like to thank Kesley and Vicky for their time and webinar today. I also like to take this opportunity to thank the attendees for taking time out of their day to join us. Just a reminder that the slide deck and recording will be posted on the ACAP website by tomorrow morning. So thanks again. Stay safe.
Thanks, everybody.
Thank you, everybody.
Bye-bye.